With a variety of treatments now available to fight off COVID-19, local experts are shedding light on the latest phenomenon a growing number of patients are experiencing. NBC4's Matthew Herchick shares what those experts are now calling Paxlovid Rebound and what it means for those who are seeking treatment.
It's become one of the most common treatments for COVID-19, and while rebound infections have some calling into question its effectiveness, health experts say that Paxlovid remains one of our best weapons in the fight against COVID-19.
We know that Paxlovid Rebound does not mean Paxlovid is not working. It does not mean that the person is reinfected with the virus again.
Early trial data from Pfizer revealed about 1% to 2% of Paxlovid recipients experience what's called Paxlovid Rebound.
My best guesstimate in my clinical practice is probably 5 to 10%.
President Joe Biden and his chief medical advisor, Dr. Anthony Fauci, both recently experienced the phenomenon. Experts say it occurs when a symptomatic COVID-19 patient completes their treatment and several days after testing negative experiences another positive COVID-19 test. While it's not yet clear what causes the resurgence, experts say there could be a case for longer treatment going forward.
Perhaps with the current variant or people who are immunocompromised, that a longer course than 5 days will be indicated. Unfortunately, we really don't have any data at all to guide us.
But that wouldn't come without risk for patients using a drug that Ohio Health's Dr. Joseph Gustado says has many drug interactions.
For example, cholesterol-type medications, many of those do not interact well with Paxlovid, and the medications have to either be held or changed when someone's on Paxlovid.
The same applies for even more vital drugs like heart medications. Dr. Gustado says further trials are underway, but there's no timeline for when new guidance on treatment may come out. In the meantime,
Paxlovid is worth taking. When you look at all of the medications that we have available, Paxlovid is the one that performs the best at this time.
Dr. Gustado says those who experience Paxlovid Rebound should not seek additional treatment or be retested. He says in most cases, the individual will experience little to no symptoms. He recommends they follow CDC guidance and quarantine again for 5 days. Local for you in Columbus, Matthew Herchick, NBC4.